everyone. Welcome once again to another educational, transformational, and exciting episode of New Beginnings. This is your host, Ferlie Almonte. Cancer. My goodness, we hear so much about cancer on social media, from our friends, from social gatherings. It is scary. As a matter of fact, I have a personal experience with that. Last November, I was diagnosed with breast cancer, and it has been a whirlwind of treatments, surgeries, and chemotherapy, and it is really scary place to be, not only for the patient like me, but also to many family members. Well, today, I felt that the one way that I could empower so many people out there is to bring an authority on cancer to New Beginnings. So I am very, very thrilled to welcome to our show Dr. Horace Tang, hematologist and oncologist of Robert Wood Johnson Barnabas Health. Welcome, doctor.
Thank you for having me.
My goodness. By the way, Dr. Tang is not only an oncologist, he is my personal oncologist. And I could attest very, very much to how unbelievably transformational and I would say relaxing and serene this whole journey has been because of how you've held my hand through the process. Dr. Tang, I would love for the audience to know what actually ignited your passion to go into the field of oncology?
So my mother was diagnosed with breast cancer when I was in elementary school. So there was a huge stress to my family. And from that point on, I tried to help patients and the family with similar situation with my knowledge and with my personal experience.
How's your mom doing?
So she did well for about 20 years. She passed away a couple years ago.
I'm sorry to hear that.
Thank you. But she did, she did very well for a very long time. So we are very thankful for her medical provider.
Well, but 20 years is a lot of blessed bonus years, right?
Absolutely.
And actually, during the time, 20 years has gone by, and so many research and development changes have been available for many of us, changing the prognosis of many cancers, right?
Absolutely. Now, in addition to the endocrine therapy, chemotherapy, we also have immunotherapy, and for certain population, we have a target therapy. So we have a whole lot more medication compared to 20 years ago.
Oh my goodness, that's wonderful to know. But we'll go back to that, doctor. Okay, we live in an active adult community. We're 55 and up here. And so I would love to know, for the people who are, well, I call them people who are more seasoned in age, what types of cancer are more prevalent for people our age?
So in America, the most common cancer are breast cancer for the woman, lung cancer for both populations, and colon cancer.
Breast cancer, colon cancer, and lung cancer.
Yes.
Unfortunately, I actually just lost my brother to lung cancer this year.
I'm sorry.
And it was really very, very devastating. Now, what would you say causes all of those types of cancer? For the most part, is it our lifestyle? Is it genetics? What's causing all of this cancer? So
for lung cancer, the primary cause is smoking. So like you said, it's a lifestyle. For breast cancer, most of the time we don't know. Sometimes it could be genetics, but I would say the main reason is we live longer these days. Compared to 100 years ago, average American lady may live till 50, and now the average age, I believe, is 82. So once you live longer, the chance of cancer is higher. And statistics show that 1 in 7 women get breast cancer sometimes in their lifetime in 2022. So there's really not much you did wrong or that cause breast cancer.
So how important or how relevant it is, the genetics, the familial?
So I would say maybe a few percentage of the breast cancer is secondary to the genetics. So, so in other words, most of the time we don't know why one person gets breast cancer but not the other one. You may heard of the BRCA1, BRCA2 mutations. Those are the most common genetic-related breast cancer. But if they are not related to that BRCA genes or other breast cancer-causing genes, most of the time we don't know. It could be a combination of things. Maybe it's the environment, the food, and most of the time it's because of the longevity.
Environment and the food. You know, you also mentioned about like the genetics, and so typically for breast cancer, let's talk about breast cancer right now, okay? How often or how early do we start testing, like the mammogram? What's the golden rule right now, gold standard actually?
So there's different organizations who give recommendations. Right now it's 50. At the age of 50, we recommend the ladies to get mammogram. But with patient with the family history, they may need to get a genetic counseling to see if they have a certain gene that predisposes them to breast cancer. In that case, they may get a mammogram or MRI or ultrasound the breast earlier. As you know, mammogram they require radiation, X-ray, for the diagnostic test. So a lot of time we don't offer it to the younger populations.
Oh, that's very interesting. I have a daughter. I'm 60 right now, and obviously now she has a family history of breast cancer. What age would you recommend that she start testing for, like for, you said do not do mammogram if it's too young because of the radiation that goes with it. And so you would recommend what?
So first, I would recommend her to talk to her primary care doctor to see if she needs to get a genetic counselor, because you asked a very good questions. So do we even need to get the being tested for the genes? That is really depend on what kind of management the patient or you know, in your case, your daughter may choose to move forward to. So let's say the genetic test come out positive, that she may have an elevated with breast cancer. Was she willing to do some preventive measures such as bilateral mastectomy and hysterectomy to prevent breast cancer when there's no cancer there? If she is not prepared for that surgery, then does she really want to know that the potential risk may be, because that may cause some other issues such as anxiety? So it's a very complicated question.
Very complicated indeed. As a matter of fact, like, that reminded me of Angelina Jolie. Actually, her mother died of ovarian cancer, and she did genetic testing, and she actually was positive, and so she chose to have mastectomy and hysterectomy. As a matter of fact, like, you know, it's a very bold move. You know, I guess I cannot speak for her, but of course you think about also her situation. She already has kids, and so, you know, like, that is something that she doesn't have to worry about having more children. Thank you for answering that question. And so let's move on to, say, colon cancer. What is the ideal age that men and women, right, should go for colon testing, colonoscopy?
Currently, we recommend all you know, men and women to get colonoscopy at the age of 45, except if they have a personal family history of colon cancer. Then we'll ask them to do a colonoscopy 10 years before their relative or family member get diagnosed. So let's say their mother was diagnosed with colon cancer at the age of 50, then we'll recommend them to start getting colonoscopy at the age of 40.
And now, so 45 or younger, if depending on the family history. So like one of the things I don't really like about colonoscopy actually is like that thing that you drink so much of, and then you have to go to the bathroom so often to the point of like disgust. So is there any other way that they can prep for colonoscopy, or is that a GI question?
Yep. So at this time, colonoscopy is the gold standard. We do have several other tests that can kind of screen for it. One thing is called a Cologuard. They will give you some testing paper to check for if there's any blood in the stool. Another test is called a virtual colonoscopy. So it is a CT scan that doesn't require any prep. But both procedure, the downside of both procedure is not you cannot have any intervention with it. As is, if you have any question, you cannot get any biopsy. So if the test is questionable, then you still have to get colonoscopy. So end up you get two tests.
How often do you have to get colonoscopy, doctor? So
in general, every 10 years. But for certain population, let's say they have a lot of polyps, or they have any family history, then they may need to get less than 10 years. And I will usually defer that to my GI colleagues.
Well, here, right now, we have a lot of baby boomers who were also smokers. Now, if people have stopped smoking, say for example, the last 10, 20 years, but they've smoked a lot during their younger years, are they still at high risk of getting lung cancer?
So their risk is higher than non-smoker. However, if they can stop smoking, the chance of getting lung cancer is dramatically decreased. In regard to the screening test, if they have a smoking history for more than 10 years, certain patients are eligible to get a low-dose CT screening test to see if they have any signs of early lung cancer.
And is there an age where people have to do that, or is it just if I have history, for example, of smoking, you just have that screening? What is that called again?
It's called a low-dose CT scan. So compared to the regular dose, they give you a less radiation for the CT scan.
And so it will detect what?
So it may detect the early signs of lung cancer. So let's say if the low-dose CT scan show mass or nodule in the lung, then the pulmonologist or the radiologist may recommend MRI or regular dose of CT scan. It depends on the situations.
Dr. Tang, obviously when people see you, they have already been diagnosed with cancer, right? But, having to find an oncologist is not an easy task for most people. What would you say are very important to consider when choosing an oncologist?
I think one of the most important things is you have to be a good fit. Different medical oncologists have different personalities, and the most important thing is they care about you. They're willing to spend time with you. They're willing to explain what is going to happen, what is the diagnosis, prognosis, and treatment plan in a layman term. Because a lot of time, my experience is, certain doctor will give you a lot of technical medical term that, most population, they're not familiar with. I think if you can understand clearly from your oncologist, that will make the treatment process much easier and will make the patient much less anxious.
Funny how you said something about a good fit, because when actually my breast surgeon is Dr. Sumi Chang, and when I asked her for a recommendation for an oncologist, she smiled and she says, Dr. Tang will be a good fit for you. Your personalities would fit, and I know very well why. Because I am actually very, very thrilled with Dr. Tang, because I am the kind of person who asks a lot of questions, and I do a lot of research before I go to see my doctor. And I want to be able to not just be brushed off when I have a lot of questions. And so what's really amazing about Dr. Tang is that I send him questions. I either, I come prepared with a list, and every single time he has taken the time to show me in his computer the different studies to support my question, and also at the same time to also appease my worries. Now, when we go and see an oncologist, of course, we also say, like we're scared. We say like, oh, how much time have I got? Not only for the patient, but also to the family members. How do you deal with emotions? Because, cancer comes with a lot of emotions. It could get people depressed. It could bring a lot of sadness. How do you deal with that? And what do you advise family members and patients when dealing with cancer?
So yeah, it's always a stressful experience when you go to an oncologist's office. But I think the most important thing is through explanations. So you know exactly what you're going to receive. Let's say the side effect from the chemotherapy. If you know that I'm going to get, let's say, decreased appetite, you may have hair loss, you may don't feel well for a few days and then you feel better. And when the side effect hit you, you'll be much calm, you'll be less anxious because you knew this coming. And also, I think it's very important that you can reach your doctor at any time. Because, let's say over the weekend, someone is going to be on call, you have anti-nausea medication at home just in case, and you know that your oncologist will send you to get maybe hydrations if you really don't feel well. I think those will make the situations easier.
And I can attest to that, because how many times have I sent messages to you because every single time you get a treatment, a chemo, a new medication from another doctor, all of them, you guys talk to one another, right? So it's very important also for your oncologist to also have a relationship, or at least communication, by the way, with other, professionals involved in your care, right? So you can more or less know what the medical condition and the different drugs and the contraindication. Now, when it comes to, say, for example, making a decision, who actually makes the decision in terms of what treatment a cancer patient gets? Because I know some people get chemo, radiation, immunotherapy, hormone therapy. How do you decide what type of therapy a person gets?
So in community medical center, we have a tumor board that we discuss cases on a weekly basis. Let's say in your case, I always discuss with Dr. Sumi Chan, your breast surgeon, before we make any decisions. So the decision is based on the stage and the type of breast cancer. Yes, there's a different type, such as estrogen receptor positive, HER2 positive, triple negative breast cancer. And also depend on the location of the tumor. So in certain cases, we'll do an upfront surgery. Some cases, we'll do upfront chemotherapy. Sometimes we give radiation after all the treatment. It all depends on the type of breast cancer.
So for those people who are watching right now and they want to know, can you explain in simple terms what chemotherapy is, radiation, and immunotherapy?
So chemotherapy is a systemic treatment.
When you say systemic, what does that mean?
It goes over the whole body.
Okay.
So it's like a medications. Sometimes we give it to you by mouth, but most of the time is intravenous. We give to you through the IV. It's a very strong medication that is intended to kill the tumor cell or prevent the tumor cell from coming back. So that's one, there's a chemotherapy. Usually that's the one that associated with nausea, hair loss, the general side effect that you may see on TV. In terms of the radiation.
Hold on, before you go, I've heard that there's also a chemo pill.
Yep.
Okay, who gets a pill and who gets the intravenous?
So most people get the intravenous therapy. The pills usually reserved for people that after surgery, they usually already have the IV chemotherapy, and because of the risk involved, they will be given a pill, a chemo pill. It happens not very often, but we do give the pill.
Is it just as effective as intravenous?
So in the setting of breast cancer, it is effective in decreasing the chance of recurrence of the breast cancer. And in certain cases, for certain patients, their disease is more advanced, they will give it in a later line of the treatment. We do give the pill a bit more often in other types of cancer because of the COVID-19 pandemic. People do not want to go to get IV injections, and they would like to prefer to get a pill. But in the setting of breast cancer, we don't use it as often.
Okay, and you said radiation is? So
radiation is a localized treatment. The idea of the radiation is by giving the laser beam, the radiation, you kill the tumor cell, or you prevent the cancer from coming back. Usually the radiation is only to one area. In the setting of breast cancer, the radiation usually go to the breast or under the arm. So that's the radiation.
And then the immunotherapy is?
So immunotherapy is one of the latest therapy. The immunotherapy, they utilize your own immune system to ask your immune system to help to fight the cancer.
Yeah. And there's also the hormone therapy. I actually have gone through the surgery, chemotherapy, immunotherapy. I'm almost done. Woohoo!
Great. Yep.
Right. It's because it's for 1 year, and then I'm still going through the hormone therapy, and I'm actually feeling beautiful and strong and like hopeful indeed, because of the fact that there are so many different types of therapies available there. Now, Doctor, with all of this now going through, there's a lot of questions we wish we could ask of you right now. But say, for example, if you were to give advice in terms of how do you prevent a recurrence, how do you prevent even like, the incidence of cancer, what things in our lives can we do differently to actually make ourselves healthy and cancer-free?
Yep. Diet, healthy diet, exercise. Exercise is the best type of method you can use to prevent any kind of cancer. And in terms of the screening test, like we mentioned, colonoscopy for men and women, mammogram for the ladies, and the lady also will recommend them to see by the gynecologist for the GYN exams. And also depend on what type of cancer, assuming that the person already have cancer, they may get hormonal treatment. So hormonal treatment, I think I didn't mention. Hormonal treatment is the treatment that will decrease the estrogen in the body to prevent the estrogen receptor positive breast cancer from coming back.
Yeah, and one other thing that I remember Dr. Tang was telling me also is that like positivity is really a great tool to keeping ourselves healthy and also more resilient during treatment, and that's why I love what you were saying about all of that. And managing, I like the educational part of what you were saying, that if you tell the patient what to expect when you go for chemotherapy, they're able to manage their expectations a little bit better. And one question that somebody have actually asked me, for those people who actually would like to take natural supplements from, like because of their culture, what is your say on that in terms of integrating it with medicine, with Western medicine?
So usually the alternative medication, herbal medication, have no contraindication to chemotherapy or immunotherapy. I don't have a lot of knowledge in regard to herbal medication. But from my background, I used to practice in New York. Quite a lot of my patients, they are Asian descendant, so they do use quite a lot of herbal medications. So usually I tell them that, hey, if it tastes good and make you feel good, no problem. a lot of time, it's hard to tell if it's a spice or if it's herbal medication. It depends on the amount you get. But I also warn them though, if there's a company try to sell you herbal medication, it will cost you a whole lot, couple $1,000s, and promise you that will reduce the chance of cancer, make you live longer. I will be very doubtful. But if any moderate amount, I'm not against it. But of course, I always tell them that I'm not a herbalist. I don't have enough medical knowledge to recommend or tell you against to using the certain herbal medications. But again, if you take the herbs, and you feel well, go for it.
I actually appreciate you and respect you very, very much because of your openness to be able to integrate Eastern medicine with Western medicine, because I am one of those people who actually take some supplements to keep myself healthy and stronger so that I'll be able to, to fight this and I go through the immunotherapy and the chemotherapy a lot more strongly, so to speak. Now, oh my God, like I cannot believe that, we were running out of time. If there is any advice that you would say, you have your own personal experience as a family member having gone through, your mother having gone through cancer. If there are a couple words of advice that you would share with a patient or family members out there who's going through cancer right now, what would you say is the one that was most transforming in your life?
So first, you make sure that you talk to your medical oncologist, get all the information you need, just like you did, have a checklist, ask all the questions that you may need, and you are not alone. A lot of patients, a lot of patients that suffer from different kind of cancer in America going through the same thing. You can go to different support group, and you can, you can also get a second opinion from different medical oncologists, just to make sure that you are getting the care that you deserve.
That's awesome. Thank you very much. So, being being educated and empowered, and also, not only from just one person, but several, authorities in your profession, is really a wonderful thing. And also, like the mindset. The mindset is very powerful when you're going through cancer. I've been through it. I'm still going through it right now, but I'm almost done. I'm cancer-free, and I would not be able to be as vibrant as I am right now, living fully and intentionally, if it was not because of the love that surrounds me, just like what you said, support group, and having good medical professionals like your oncologists, your surgeons, your general practitioners. When you begin to have an open dialogue, that's one thing I really appreciate about you, Dr. Tang, is the open dialogue that we're having. It's like, I'm not scared. You should feel comfortable speaking with your doctors, and don't, because sometimes you feel funny and like, oh my God, this is an embarrassing question because it's a little too personal. You know what I'm saying? I'm sure you've heard it all, right? And so, and the more open we are in
online, and then you can look. You can ask for me, Horace Tang, and they will give you my office number, and our office will give you an appointment, as soon as possible.
Yeah, and actually, I love the fact that I was able to get in right away, because you want to be able to be taken care of right away. And also, do you see your patients in just one office, or do you have several offices that you see patients at?
I only see patients in my Toms River office.
Toms River office, right on 37. That's where I go and see him.
Yep.
Well, anyway, my goodness, as I've said, this has been an incredible, incredibly educational and transformational segment. I hope that you have learned a lot from this about cancer, the importance of cancer screening, the importance of positive mindset, the importance of being able to have a good relationship with your oncologist if you are going through cancer or a family member is going through cancer. Don't be ashamed to ask questions, because no question is silly, because those little things that's bugging you, don't let it eat you up, right?
Absolutely.
And so remain positive and choose to be resilient in this day when cancer is just going to be a part of history. That's what I'm actually programming myself to be. And so, Dr. Tang, thank you so very much. You're also a hematologist, so that's for blood.
Yep, for anemia, for high red blood cell, low red blood cells, any platelet disorder, I also take care of those conditions.
Oh, thank you so very much. Okay, until next time, this is Ferlie Almonte with Dr. Horace Tang, medical oncologist. Until next time, stay well and always stay positive and choose to be resilient.